Welcome to the Workplace Minute, powered by H3HR Advisors and sponsored by Paychecks, one of the leading providers of HR, payroll, retirement, and software solutions for businesses of all sizes. My name is Steve Boese. North Carolina State Health Plan to end coverage for weight loss drugs. In June 2021, the insurance plan for North Carolina state employees was paying for 2,800 people to take weight loss drugs. But in 2023, it paid for nearly 25,000 plan members taking these drugs. Medications like Wegovy cost the North Carolina State Health Plan $100 million last year, rising seemingly out of nowhere to represent 10% of total plan spending on prescription drugs. Concerned by the rapid increase in cost, the health plan's governing board voted last week to end all coverage of medications for weight loss, including Wegovy, which accounts for most of its spending on obesity drugs. The plan will continue covering versions of these drugs for people with diabetes. In the past few years, appetite-suppressing drugs have surged in popularity because they are extraordinarily effective in helping patients lose weight. Research suggests these medications may pay for themselves or even save money in the long run by preventing heart attacks and strokes that lead to big hospital bills. But for employers and health plans that cover most of the cost of prescription drugs, the bill for these medications is overwhelming, and it's now coming due. In recent months, the University of Texas system and the hospital chain Ascension have stopped paying for the drugs for their workers. Those that continue to cover the drugs are imposing new restrictions meant to cut costs. The Mayo Clinic, for example, will now provide a lifetime benefit of only $20,000 for these drugs for its employees. Medicare, by comparison, does not cover medications prescribed for weight loss, but does cover weight loss surgery. In North Carolina, the recent decision to end coverage for these drugs appears to be the first in the country by a state health plan. The plan uses state funds to pay most of its prescription drug costs for 740,000 public workers, teachers, retirees, and their family members. But the state health plan is in financial distress. Last year, its cash position declined by $250 million. The trustees who voted to end coverage said they had a duty to do the most good for the most people covered by the plan. Coverage of these medications for weight loss will end in North Carolina on April 1, 2024. To continue taking the drugs for weight loss, North Carolina State Health Plan patients will have to pay out of pocket. Medications can cost more than $16,000 a year without insurance coverage, a daunting prospect for workers whose average annual salary is only $56,000. Most patients regain the weight they have lost if they stop taking the drugs. In recent weeks, state health plan officials have explored whether they could cut costs by placing restrictions on who could get the drugs, but they were told they could not do so without losing $54 million in discounts this year from the drugs manufacturers. Spokeswoman for Novo Nordisk, the maker of Wegovy, called the trustees' decision to end coverage, quote, irresponsible, adding that the company had been working with the state health plan officials to address their concerns about cost. And some in North Carolina see an irony in the fact that Novo Nordisk manufactures and packages Wegovy in Clayton, North Carolina, just a short drive from the government offices where state health plan officials try to figure out how to pay for the drug. The company's critics have called attention to the tens of millions of dollars in incentives that Novo Nordisk has received from the state, as well as from the county where its plants reside. State health plan staff have been closely monitoring the growth in Wegovy spending, and about a year ago, it became the costliest medication for the health plan, outpacing the plan's long-standing top expense, the popular anti-inflammatory drug Humira. But the North Carolina State Health Plan had been more lax than other employers and insurance programs in how it covered the obesity drugs. Until recently, patients could get coverage without supplying documentation that they had the body mass index or certain medical conditions that the Food and Drug Administration has approved for eligibility for these medications. Ultimately, the board voted narrowly 4-3 to end coverage for the drugs. We will continue to monitor how large and small employers alike plan to deal with the increasing cost and popularity of weight loss drugs and the impact to employee benefit plans here on the HR Happy Hour Media Network. That's it for the Workplace Minute, powered by H3HR Advisors.